Hi everyone, welcome back to my YouTube channel and today we are going to talk about dural venous sinuses. So let's start topic with introduction. Dural venous sinuses are large endothelial lined venous channels that are located between two layers of dura mater in the brain. They play a crucial role in venous drainage of the brain, collecting blood from cerebral vein and cerebrospinal fluid from the subarachnoid space through the arachnoid granulations. Eventually, they drain into internal jugular vein, maintaining circulation and intracranial pressure balance. Structure and anatomy of dural venous sinuses. Dural venous sinuses are formed by separation of periosteal and meningeal layer of dura mater. They are lined by endothelium, but unlike normal veins, they have no walls and no muscular layer. They allow free venous communication and can explain the spread of infection from the face to cavernous sinus. Major dural venous sinuses include superior sagittal sinus, inferior sagittal sinus, straight sinus, transverse sinus, sigmoid sinus, occipital sinus, cavernous sinus, superior and inferior petrosal sinus, and sphenoparietal sinus. Now let's talk about these sinuses one by one. First is superior sagittal sinus. It is run along the superior margin of phalanx cerebri. Its function is to collect blood from superior cerebral veins and CSF through arachnoid granulation. It drains into confluence of sinuses at the internal occipital protuberance. Second major sinuses is inferior sagittal sinus. It runs along the inferior free margin of the phalanx cerebri. It joins the great cerebral vein of Galen to form the straight sinus. Third sinus is straight sinus that is located at the junction of phalanx cerebri and tentorium cerebelli. It receives blood from inferior sagittal sinus and the great cerebral vein. It drains into confluence of sinuses. Fourth sinus is transverse sinus. It extends laterally from the confluence of sinus in the attached margin of tentorium cerebelli. It continues as sigmoid sinus. Fifth sinus is sigmoid sinus. It is S-shaped sinus that continues from transverse sinus. It exits the skull through the jugular foramen as the internal jugular vein. Sixth sinus is occipital sinus. It lies in attached margin of the phalanx cerebri. It drains into the confluence of sinuses. Seventh sinus is cavernous sinus. It is located on either side of body of sphenoid bone, lateral to sella turcica. It receives blood from ophthalmic vein and communicates with facial vein, making it clinically significant for the spread of facial infection and drain into superior and inferior petrosal sinus. Then there is superior and inferior petrosal sinuses that connect the cavernous sinus to transverse or sigmoid sinus and internal jugular vein respectively. Then there's sphenoparietal sinus that is located along the lesser wing of sphenoid bone. It drains into cavernous sinus. Functions of dural venous sinuses. First function is venous drainage as it collects blood from cerebral veins, meninges and diploic veins. Second function is CSF absorption as these dural venous sinuses receive CSF through arachnoid granulation. Third function is communication pathway as they connect intracranial venous circulation with extracranial veins. Fourth function is pressure regulation as dural venous sinuses maintain balance between CSF and venous blood pressure. Clinical significance. First is thrombosis of dural venous sinuses, that is obstruction due to clot formation that lead to headache, seizure, papilledema and neurological deficits. Second is cavernous sinus thrombosis that is caused by infection that spread from the face and it leads to ophthalmoplegia, proptosis and fever. Third significance is raised intracranial pressure that is impaired CSF absorption at arachnoid granulation and it can cause hydrocephalus. Fourth is spread of infection that is lack of walls that allow retrograde spread of infection from extracranial to intracranial venous system. Conclusion of this lecture video. Dural venous sinuses are essential venous channels within the dura mater that drain blood from brain and CSF from the subarachnoid space into the internal jugular vein. Their unique anatomy, lack of walls, and extensive connection make them vital for cerebral circulation but also vulnerable to infection and thrombosis. A strong understanding of their anatomy and clinical importance is crucial in neurology and neurosurgery. And this was all about dural venous sinuses. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.